Practical.
Just answering questions. Hello, my name is Jennifer Powell, and this is for NU 650 health assessment. Today I am going to be completing my head and skin assessment today on my patient Madison. Madison, do you consent to me doing this exam and to record it?
Yes.
Yes. Thank you. So I've washed my hands and we're going to begin. So I'm going to start with the head and just assess that the hair is evenly distributed and healthy. There is no signs of rash or flaking, lesions. Any tenderness?
No.
Okay. We're gonna then go to the face and neck. Just going to move this pillow just so slightly. You can see everything. Beautiful. And there are no signs of rash, petechiae, lesions, or elevated nodules on exam. I'm then going to look at the eyes, and her sclera are white. Just going to pull down here. Conjunctiva are pink. Take a peek here. Pupils are 4 millimeters round and responsive to light, brisk response. Her eyelids are intact, no lesions. If I take a look, eyelashes and eyebrows are symmetrical. Hair is evenly distributed. I'm now going to assess her tympanic membrane. Let's take a peek in here. So I would be using my otoscope to look in her ear. Any tenderness?
No.
So in the tympanic membrane, it is intact. There's no inflammation noted, no lesions or masses noted. When I palpate, there's no tenderness noted. I'm now going to check in her oral cavity. So I'm going to assess the lips. They are pink and intact, no cracking noted. There's no inflammation. They're moist. And I check inside of your mouth. Mucous membranes are moist. And there's no evidence of thrush or vesicles in the oral cavity. She has good dentition and all teeth are in place. Now I'm going to assess her skin. So on the skin, her nail beds are pink, crescent-shaped nail bed with an even hue. Both hands with no signs of clubbing, lesions, no cyanosis noted to the fingers. Let's see on the other side. Beautiful. Doing great. I'm going to continue down the rest of the body. Is that okay?
Yes.
Great. So as I come down the body, toenails are intact. There's no clubbing, cyanosis noted on the lower extremity. No rashes, lesions, or ecchymosis noted to the anterior body that I can visualize. As I palpate, the skin is warm, dry, and intact. Hair is evenly distributed throughout. Can you stand up for 1 second just so I can visualize the posterior part of your body? Just over here. Great. I'm just gonna look. And same as anterior, no rashes or lesions, ecchymosis, petechiae to the posterior part of the body. You can lay back down for me. So now I'm going to begin the abdominal exam. So if you can lie relaxed with your hands on either side of your body. Are you having any pain or discomfort just while lying here?
No.
No, great. And so the patient is lying down, no obvious signs of distress at rest. And then as I observe, I can see that her abdomen is flat with no distension, no nodules, it's symmetrical. There's no obvious scars or striae, no rashes or lesions, pulsations or bulges noted on inspection. So next I'm going to have to auscultate with my stethoscope. Great. After 1 minute of auscultation, I hear normal reactive bowel sounds that are approximately 10 to 13 gurgles per minute. I did not hear any bruits, rubs, or friction on auscultation to the aortic, iliac, renal, or femoral arteries of the liver or spleen. Just gonna listen again. Tympany noted to the left upper and left lower quadrant, and a little bit of dullness was noted to the right upper quadrant. You're just going to feel me tap. Any pain or tenderness?
No.
Just going to take this tool. Measure. Liver is approximately 7 centimeters, mid-clavicular line. Can you take a deep breath for me? Beautiful. Tympany noted, no concerns for splenomegaly. I'm going to palpate here. Any pain or discomfort?
No.
Spleen is not palpable. So now I'm going to just push on your abdomen to see if there's any tenderness. Any pain or discomfort?
No.
In the abdominal exam, there is no tenderness or muscle resistance or guarding. Superficial muscles, there's no superficial masses noted, no pulsations noted. I'm gonna look for your right lower quadrant. Okay, the McBurney sign is negative. Palpate the left. And the Rovsing sign is also negative. I'm going to palpate the right upper quadrant under the rib cage. Any pain or tenderness?
No.
The Murphy sign is also negative. The liver is smooth and palpable, about 1 centimeter below the right costal margin. I'm going to actually place my hand on your right knee. If you can push against my hand. Okay. psoas sign is negative. Just gonna rotate you in. Any pain or discomfort?
No.
Beautiful. And then same on this side, if you can push towards, beautiful. Now I'm just gonna have you rotate in. Beautiful. And now I'm just gonna have you stand so I can check down for any tenderness posterior. You can actually sit. Any tenderness or pain?
No.
Beautiful. No cervical tenderness noted. And that completes our exam. Thank you.